This little dog is Callie Blue. Callie is here to have her teeth cleaned today, but Callie, being a miniature Schnauzer, has risk for several different types of eye diseases. And in fact, Callie has been to a veterinary ophthalmologist and had treatment for a couple different things. So we're going to show you how we measure tears, because a lot of little dogs, including Schnauzers, will have dry eyes as they get older, and they'll need ointment for that. And then we're also going to check her eye pressures to see if she has glaucoma or uveitis. And she actually does have uveitis in one eye, so we're going to be monitoring that today. She just saw the ophthalmologist a week or two ago, and he was concerned that her eye that's really dry is going to get even more dry today while she's under anesthesia. So we are also going to change our anesthetic protocol a little bit, so she will get eye ointment put in her eye multiple times over the course of the day while she's here. So Schirmer tear test is pretty easy. We have a little paper strip, and it has a little ribbon of dye in it. And we hook that onto the lower eyelid. And then we just let it sit for 1 minute. And so that strip is going to get wet with the tears that Callie is hopefully producing, and we'll be able to measure how many millimeters of tears she produces over the course of that minute.
And if you want
All right, so in this left eye, she has wet 17 millimeters of our little strip, and we want at least 15 millimeters to be normal. So in the right eye now, we have 20, which is great. So she's much better than she was a few weeks ago when she went to the ophthalmologist. One eye was almost at 0. So he adjusted her medications, and now things are going much better. Next, we're going to test her eye pressure. So we're going to put a drop in each eye of proparacaine, which will numb the eye. And then we'll wait a minute and do that one more time. We're going to need to tap on her eye with our little instrument, which is not very comfortable unless the eye is numb. So our little instrument here is called a Tonopen, and we're going to tap it on the eye, and it's going to measure the tension of the cornea, the clear window at the front of the eye, and it's going to translate that into a pressure reading. So we turn it on, and it beeps to say it's ready. We got 9 in the right eye, so it's going to beep 4 or 5 times and average those readings out. So this left eye that I'm doing now has been treated for glaucoma. The pressure in this eye is now very low. And we try to catch these eye problems as early as we can, because both glaucoma and dry eye are painful diseases. So we're going to measure her tear production, and any Schnauzer that comes in the door or any other breed that's prone to these diseases, we're going to monitor that throughout their lives so that we can catch problems early and treat them before they become painful.